Yeah, we got 4 online. Go ahead, introduce yourselves. We'll start from my right to my left. Ms. Bush, go ahead.
Good morning, Mr. Chairman, members of the committee. Sheila Bush with the State Medical Society, and this morning also here on behalf of the state chapter of the American Academy of Pediatrics. To my right is Dr. Mike Sanderson, president of the Wyoming chapter of the American Academy of Pediatrics. You've all heard most of my statements on this before, and so I don't want to belabor it too much. The Medical Society, again, stands opposed to this bill. Sadly, despite our repeated offers to work with the sponsor on this bill last year, that didn't come to fruition, and so we were again not included in the language, which I think is unfortunate. We were able to work with a sponsor on the House side on a bill that was far cleaner and would have accomplished, I think, what the primary concerns are, which continue to sound to be like surgery. And so I'll repeat again, gender reassignment surgeries are not performed in Wyoming. We don't have the subspecialty teams here to do those surgeries. Any notion or story otherwise is just purely not true. And so we also would offer, we have a very diverse membership. We have over 1,000 members, all physicians, PAs, medical students, and residents. There's great debate on this topic. There is not debate about surgery. They stand with you in that sense. However, there is a lot of conversation and ongoing debate within the medical community about what the medical treatment looks like, what gender affirming care, what the standards should be, what the evidence suggests, and it's a growing body of evidence. And we would offer that passing a law would stand in the way of medicine doing what we've always asked of it, which is to advance and grow and use what is available to continue to sharpen and get better. And passing laws that stop that and are overly prescriptive in statute, dictating the practice of medicine, represent not only an overreach of government, but also a halt or a ceasing of allowing the medical community to advance on its own. And so there's a myriad of examples we could talk about where this has happened and the medical community has self-corrected through time. And I'd be happy to talk about those individually or later. But for that, I will yield my time to Dr. Sanderson. He has more to offer. This is a complicated topic and really one that should be discussed and debated by medical professionals, not members of the legislature, I would argue. And so with that, I will yield my time to Dr. Sanderson.
Dr. Sanderson, go ahead, sir.
Mr. Chairman, Chairman Baldwin, Senators, thank you for the opportunity to speak to you today. My name is Dr. Michael Sanderson. I am a pediatrician of 5 years from Sheridan. I am actually a 5th-generation Wyomingite. I was born and raised in Casper. My roots are mostly from the Bighorn Basin, Worland and Grable, although I am enjoying Sheridan very much. And I've been a resident of this state my entire life, with the exception of my secondary education, a 2-year mission for my church. And I'm here to speak in opposition to Senate File 98. Senate File 99, I think is what that is. For a few specific reasons, which I'm happy to go into. And first and foremost, I think the most important reason is because I don't think that this bill was a bill that was crafted for Wyoming or for Wyomingites. Miss Chloe Cole, I'm thrilled that she's here today, and I was happy to hear her story. And my understanding of Miss Cole's situation is that she was inappropriately fast-tracked into medical and surgical treatment for gender dysphoria. The American Academy of Pediatrics has already come out in open opposition to surgical treatment for minors seeking gender-affirming care. That is already a part of the standard of care. We do not recommend that children receive these surgeries. This does not happen, and it has never happened, and it will probably never happen in the state of Wyoming. The American Academy of Pediatrics has already come out in open statement that the vast majority of patients, of minor patients experiencing gender dysphoria, should not receive medical treatment for gender dysphoria, except in the most limited of circumstances. These are careful and elongated conversations that take place between a patient's doctor and their family and their mental health counselor over long periods of time. That is the standard of care. That is what happens in the state of Wyoming. And this bill was crafted based on outside influence and outside experiences for a state that has not experienced that and for a state that is not set up to experience that. If the Senate and the House had come to the Wyoming chapter of the American Academy of Pediatrics, and if they had come to the Wyoming Medical Society and sought to create a bill that would actually address this issue in a way that would help Wyomingites on both sides of this problem, we would have entered into those discussions and we would have parlayed with you. That would have happened, but that did not happen. And I invite you in the future to do so. The second major opposition that I have to this bill is that it is frankly an inappropriate intrusion to the practice of medicine. And I am deeply concerned with the tone and the interest that the Wyoming legislature seems to have in stepping between Wyoming citizens and their doctors. And it seems to be an increasing trend over time. This is highly inappropriate and it is dangerous. Every time that you do this as legislators, you send a message to Wyoming citizens that you know better what they need than they do and that their doctors do. Every time you do this and you bring these bills before consideration, you send a message to Wyoming doctors that our choice to come back to Wyoming and practice medicine for the benefit of Wyoming citizens is not welcome here. And frankly, you drive physicians away from our state who are currently practicing here, and you keep them away from those who would consider coming here. I currently help own and run a pediatrics clinic in Sheridan, and I have interviewed many doctors for much needed to fill pediatrics positions in Sheridan. And several of those interviewees have told me that they also are deeply concerned with the tone that the Wyoming legislature is taking towards the practice of medicine. This is a major issue for our state. Wyoming lawmakers do not belong interfering in the medical care that Wyoming citizens seek from their medical doctors. And for that also reason, I oppose this. The final reason that I oppose this is because I don't think that the Wyoming legislature has really considered the implications for Wyoming citizens and Wyoming taxpayers. Alabama and Indiana have already had similar bills held up and held in federal court. Arkansas has had their gender-affirming care struck down. This is likely headed to the Supreme Court. And it seems that Wyoming senators are more interested in saddling Wyoming taxpayers with an expensive, drawn-out court battle than they are meeting the needs of Wyoming citizens. And again, that evidence to me would have been if you would have come to us and you would have sought to find resolution in compromise and in co-working with each other, then that story would be different. We have heard testimony from many people here today that this is a dangerous method of treatment for minors and children. And I want to once again testify that the scope of what is happening here does not happen in the state of Wyoming. Wyoming physicians practice according to the highest ethical ideals and the best medical evidence, Senator Hutchings. Mr. Chairman.
We'll pause right there for 1 second. We don't speak to, you can speak through the
Excuse
chairman, and we don't roll eyes, we don't attack one another, so please address the chairman and
Excuse me.
go ahead and complete your term.
Apologies, Chairman Baldwin. Wyoming physicians are held to the highest ethical ideals. We practice according to those standards. We are up to the task to work through this difficult issue. And this is why I am asking the Wyoming Senate and this committee to defeat this bill and to send a signal to Wyoming citizens and Wyoming physicians that you trust us and that we are welcome here and that our contribution to this state is welcome here. Thank you.
Questions for Dr. Sanderson or Ms. Bush? Senator Barlow.
Thank you, Mr. Chairman. So my question is, page 4 of the bill, and you've reviewed the bill, I'm sure, so you're familiar with it, Dr. Sanderson. There are things that it does not apply to. And I guess my question is, when you look at those things, medical verifiable genetic disorders, central precocious puberty, is there other things that you think could be added to this bill that do fall within what your academy, your profession believes are appropriate and still honor the things that your academy says are inappropriate? So is there anything in this that we can do to to improve this to the standards of your profession? Thank you, Mr. Chairman.
Dr. Sanderson.
Mr. Chairman and Senator Barlow, thank you for the question. I could come up with several examples. For instance, there's one condition called endometriosis, which is where uterine tissue grows outside into the abdominal cavity. Some of these medicines are used for that specific purpose. Frankly, there are, and this was testified in this very committee last year by Dr. Franklin, who is a board-certified obstetrician and gynecologist. The number of medical diagnoses that are potentially implicated by blocking the use of gonadotropin-releasing hormone agonists, specifically puberty blockers, and hormone replacement therapy are too numerous to count. And it is difficult in this limited setting to go into great detail on what those are. But I'd be happy to, again, we would happy to again, go into those in cooperative sessions. So, yeah.
Further questions? Seeing none? Oh, go ahead, Senator Bouchard.
Thank you, Mr. Chairman. You know, I've heard a lot of what you've said before. And what's really odd is it was in front of a board where they were trying to put these procedures that we're trying to block here into a hospital. And there were some really key words that person said. They said, there's big money in this. And that's what makes me go like this when I hear everything, because I heard all of that, those things. Oh, we've got to do this for all these right reasons. And there's big money in this. And that's where I'm having a problem.
Is there a question in there?
I'd like an answer on what the big money.
I'd appreciate, committee, let's make sure we're asking questions. These folks are here to testify to us.
Mr. Chairman, Senator Bouchard, I would like to once again reaffirm that Wyoming doctors practice according to the highest ethical ideals and the best evidence. And if the senator is implying that Wyoming doctors are more interested in pipelining our Wyoming youth for the sake of making money, I would disagree with that.
Okay, thank you very much. Okay, next gentleman, go ahead, sir.
Thank you, Chairman.